Hi everyone, this is Dr Eyetemou Miguel, your pharmacist, and welcome to my channel. In this new video, we are going to talk about an important organ for female reproductive system, which is the uterus. We are going to talk about the uterus to define it. What is the uterus? We are going to see its dimension, its location in your body. We are going to talk about the main functions. What are the main roles of the uterus in your body for your health maintenance? We are going to talk about some few conditions, the main conditions that might affect your uterus health, and we are going to see how those conditions show themselves, the symptoms, and then we are going to end the video with 5 types of food that are so good for your uterus to keep your uterus healthy and safe and away from diseases. Let's start by saying that the uterus is part of the female reproductive system. It is a muscular organ, so it is mostly made of muscles, and it is located between your bladder and your rectum. The length of the uterus is 6 to 8 centimeters. The thickness of the wall is 2 to 3 centimeters. The width at the top, where it's called fundus, is 6 centimeters, and the width at the bottom, at the isthmus, is 3 centimeters. The uterus is surrounded below by the vagina, where the sperm is deposited during a sexual intercourse, and it is followed upward by the fallopian tubes, where the fertilization occurs, fertilization of the egg by the sperm cell to have an embryo and fetus and a baby later on. So let's talk about the few main functions of the uterus. One of the main functions of the uterus is that it's going to nourish and house the fertilized egg until birth, delivery. That's what is called implantation, because when during ovulation, your ovaries produce an egg, and if there is you have sexual intercourse in that period, one sperm cell is going to meet your egg in the fallopian tubes, but the egg or the embryo is not going to develop in the fallopian tube, because if it does so, that will be called an extrauterine pregnancy, and this is an abnormal pregnancy. This is a medical emergency. So your fertilized egg will then move from the fallopian tubes downward to the uterus and will implant in the uterus, where it is going to grow. It's going to have all the nutrients, the proper environment, the blood, and all the nutrients needed for its growth till it reaches viability to get out through delivery out of the womb. So this is one of the main role of the uterus. The other role of the uterus is that it's going to serve as a birth canal with the vagina during delivery. So your baby is going to get out of the uterus and go to the vagina and get out of your womb. And also it helps with the menstruation, because during ovulation, the uterus wall is going to grow, is going to thicken to prepare to receive an egg, a fertilized egg. But if there's no fertilization, the wall is going to shed and then to be eliminated through menstrual bleeding. The conditions that can affect the uterus are the infections. Those infections might be caused by internal or external bacteria. By internal bacteria, we have vaginal bacteria, because the vagina is a place where there are a lot of bacteria, a lot of good bacteria, but sometimes also, in case of infection, a lot of bad bacteria, harmful bacteria. So some of these harmful bacteria might migrate and go upward to the uterus and cause a uterine infection. But we can also be infected by your partner through sexual intercourse with bacteria such as chlamydia trachomatis. Apart from infection, you have tumors, and in tumors you have benign tumors and malignant tumors. In the benign tumors, you have fibroids, polyps, and in the malignant tumors, you have cancers. And one of the main cancers of the uterus is the endometrial carcinoma, which accounts for 90% of all uterine cancers. And in 2018, it caused the death of 90,000 women worldwide, and 380,000 new cases were recorded in 2018. And we can also have endometriosis, which is a situation in which some tissues of your uterus are going to get out of the uterus, the uterine cavity, and go and develop in other places such as the fallopian tube or the ovary. How can you know that you might be having a uterine issue, a uterine condition? You might have symptoms such as dyspareunia, which is a painful intercourses. So you feel pain when you have a sexual intercourses. You may also have bleeding outside of your normal bleeding period, outside of your menses, your monthly menses. You may also have a dysmenorrhea, which is characterized by painful menses. So you have a lot of pain during your menses. You may also have pelvic pain, and also infertility is one consequence or one symptom of issues with your uterus, because as we have seen, there cannot be a normal pregnancy without the uterus, because this is the place where your embryo is going to grow, it's going to be nourished, and it's going to develop. Now let's end the video with 5 types of food that you as a woman need to be eating on a regular basis to keep your uterus away from those health conditions, from any harm. Number 1, we have fresh fruits such as avocado, berry, apple, pear, and pomegranate. These are rich in vitamins such as vitamin C and bioactive compounds such as flavonoids, and they are going to help you prevent fibroids and cancer. So if you want to snack, if you are a little bit hungry and you want to snack, it will be preferable for you to go for a fruit. Number 2, we have leafy green vegetables such as broccoli, spinach, kale, lettuce. These are rich in minerals and vitamin B9, so they are going to be good not only for your health, but also for your overall health. Number 3, whole grains are very good for your uterus, such as rice, corn, wheat, sorghum, oat, and barley. Whole grains comes with 3 components, 3 parts in their structure. You have the bran, the germ, and the endosperm. The bran will provide you with fibers. The germ will provide you with vitamins and minerals, and the endosperm is made of starch. So why choosing whole grains? Because refined grains have only one element in their structure, which is the endosperm. And as I've just seen, the endosperm is rich only in starch. So by choosing refined grains, you are going to load your body with starch, with glucose, with sugar, and that will be deleterious to your health. But on the other hand, by eating more and more whole grains, you are going to load your body with essential nutrients such as fibers, vitamins, and minerals. So it will be better for you to go for foods that are made out of whole grains. These whole grains are going to help you prevent fibroid tumors. Number 4, lemon is an ally of your uterus health. There are many people who used to take lemon water on a regular basis, and if you're a woman, it would be advisable for you to take a lemon water or lemon on a regular basis, because it's going to provide you vitamin C, and the vitamin C will boost your immunity, your immune system, and that will prevent infections of your uterus. And number 5, you have nuts and seeds. Nuts such as pistachio, peanuts, and also hazelnuts, and seeds such as chia seed, flax seed, and sunflower seeds. These are rich in phytoestrogens, proteins, vitamins, minerals, fibers, and omega-3 fatty acids, which are good for your heart. And all those elements are going to improve your uterus health. They're going to help you stay away from fibroids and from cancers, and they're going to improve the birth weight of your baby for those who are pregnant. Thank you for having watched this video. Please consider liking, sharing, and subscribing to my channel for you not to miss any upcoming video.